Hi. Hello. Hi, Sergio. Can you listen to me?
Yes. Hi. Can you hear me?
Yes, I can.
Oh, okay, perfect. Yeah, I can right now. Do you?
Okay, it's okay for me.
Perfect. Yeah, I'm like right
Okay.
now on my way to my hotel, but I don't have any problem because I get there in like 15 minutes. So no problem.
Okay. Uh, let's continue then. Visitors in Bolivia.
Sorry, what was that? What in Bolivia? Can you hear me? You
Yes,
know,
now I can.
yeah. No, I was asking what was that in Bolivia? What? Can you hear me? Huh? You cannot hear me, Argentina, or
Then no.
I mean, I can hear you, but
Okay, a ver,
I don't know if you can hear
continue.
me.
I think we won't gonna make it. You're muted, Sergio.
Oh, okay. Now, yeah, no, I was asking, what were you asking me about Bolivia? You don't hear me?
Okay. What? Yes, no, I can. What immunizations are advised for visitors in Bolivia?
Okay, the vaccines that are advised are yellow fever, for example. Um, that would be like the mandatory one, but which else would be required, like for Bolivia, for travelers? Well, now COVID, like you have to present or show your vaccination record, right? But
Mhm.
right now it would be COVID and yellow fever, I guess, to travel to Bolivia, like persons from other countries, right?
Okay. I couldn't listen the last part.
Oh no, I was just telling you that it would be a COVID vaccine and a yellow fever vaccine,
Okay. Okay.
and that would be the mandatory ones. But apart from that, I don't think there is another one that is mandatory.
Okay. And what about where you are right now? What
Uh,
kind of vaccines? Yeah.
like to come here to the US, the only one that was that I had no choice, it was the COVID vaccine. I had to
Oh, okay.
get my booster shot,
Mhm.
so not just the first and second dose, but a third one, so that I can get here safely. Yeah.
Mhm. Okay. Okay, perfect. And which diseases have the highest incidence in our country?
Right now, what I'm familiar with in terms of the epidemiology in Bolivia is COVID as the first one, the most probably the most important one right now because of the fifth wave right now in Bolivia. Um, Dengue will be also one. Influenza. I don't know if I'm missing one or I'm forgetting some important one. Well, I mean, monkeypox will be like a new one, but it's not one that it's not a disease that right now has a high incidence in Bolivia, but it's a new one that can probably have a higher incidence in the next month, right?
Mm-hmm. Okay, and which is the common cause of death in men and women?
The main cause of death where? Sorry?
The cause of death in men and women.
Oh, but the main cause or where or I
What
mean,
is the common cause?
oh, the most common cause, but talking about
Mm-hmm.
diseases in all over the world, or
Yes, in our
uh,
country.
well, right now I think it would be coronavirus, like the most deaths right now. Probably diabetes, uh, hypertension also. Um, which one else? What else it could be?
Do you think
Yeah,
it can be uterus cancer for women?
yeah, yeah. Probably cervical cancer also caused by papilloma virus.
Okay. And in men, what was the cause? I'm sorry, I couldn't listen.
In men, right now, probably it would be coronavirus, but like in a specific disease for men, right now, the most common one would um,
Maybe not a disease like that, but maybe the common causes for
oh,
death
okay,
of a man.
probably road traffic accidents.
Okay, yeah,
Yeah.
most common one. Okay, and changing the topic, what are your views on assisted dying?
My views on assisted dying. I mean, I think I best base my opinion on my religion. I just think uh, anyone should decide on whether someone should live or not. If someone is like struggling with his life and it has a disease, a terminal disease, I would probably, if I be the doctor in charge, I would probably decide that palliative care would be the best option. But I wouldn't like decide to give the patient a treatment that will finish his or her life. So yeah, I mean, like I said, like I said, I mean, I base my opinion on my religion. I think only God has the final decision, and if the person dies of a natural cause, that will be the
Mhm.
right way to go there.
Okay. Okay, Sergio. And maybe the last question. Describe a research study that you carried out or you are interested carrying out.
Okay, well, probably the one I'm in right now, which involves patients that are diagnosed with HIV. It's a research study. It's a research study in which we're trying to find.
Mhm.
Oh, I'm filling out the questionnaire.
Okay, while you're explaining, please try to fill it. Thank you so much.
Yeah, the 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 research study I'm in right now, it involves patients with HIV, in which we're looking for new ways. We're looking for new ways to diagnose patients that have co-infections, patients with HIV that are also diagnosed with, for example, toxoplasmosis, Chagas, um, tuberculosis. So the neurological, so the neurological, sorry, the neurological ways that disease can manifest in these patients with co-infections. And we're looking for, like I said, ways to diagnose, new ways to
Okay.
diagnose
Okay.
diseases.
I'm so sorry. I couldn't the last part.
Okay, no problem. Oh, the last part? Yeah, no, I was just saying that. Can you hear me now? Can you hear me now, Ms. Encina?
Hi.
Yes, Ms. Encina? Yeah.
Okay, I'm sorry.
No worries. Uh, yes, I was just saying that my research study right now in the project I'm working is
Mhm.
based in looking for new ways to diagnose patients with co-infections, HIV patients with co-infections. For
Okay.
example, looking for a way to collect urine samples in HIV patients to diagnose, for example, tuberculosis.
Okay.
Yeah,
Okay, you arrived.
yeah, I'm around to get here. Sorry.
Okay, Sergio, no worries. We are gonna continue the next time. Okay.
No
I want you
problem.
to explain to me that case you're working on. And see you tomorrow at 8. Okay. Okay.
Okay, perfect. Thank you, Mrs. Zina.
Thank
Bye.
you. Take care. Bye bye. Hi, Claudia. Good evening.
Hi, teacher.
How are you? I'm sorry. We had some trouble with our connection, and he was traveling to his
Don't worry.
house. It was a little chaotic. How are you? Are you in Bolivia?
Yeah, I'm in Bolivia now. Tired. I'm just arrived to work.
Yes, I can imagine that. after those days of happiness?
Yeah, it was stressful too.
Yeah.
It was
Why?
also like a vacation, you know.
Why was that? Don't
Uh,
tell me that people were calling you and telling you, What are we gonna do with the patients?"
yeah, I had that kind of calls. Also, so many things, but it was good. I hardly recommend it to travel there.
Okay, I will. I will. How is the exchange or the change?
It's crazy, you know.
Ah,
Everyone thinks that everything is cheaper there, but it's not on that way. So
mm,
hotels and the big stores or malls manage the change with the blue dollar. That is the exchange that they call it with the, I don't know how to say in English, but here we call it librecambistas.
yeah.
So they manage the or selling the things, the clothes on and the hotels, as I told you, with that amount of money. That it's, you know, when I was there, $1 it was 320 pesos. So
Okay.
it was a lot, but the official exchange is 130 pesos. So, you know, it's the double. So it's not convenient to exchange your money in an official house of exchange. It's
Uh,
better to exchange your money with that people that works with the blue dollar.
wow.
But you for the food, it's incredible because the food maintains the prices. So you can eat a lot with maybe $20 or $10. You can eat very delicious. And if you know the places of where to buy clothes, especially shoes or purses,
Mhm.
uh, uh, you can change. You can have it very cheaply. You know, I bring maybe three purses of leather, and maybe all of them cost me $80.
Wow.
But yeah, and each purse it was maybe, I don't know, $10. So
Wow.
so it's very
Yeah, there
convenient.
is a difference.
Yeah, but in the
Yeah.
big stores or the malls, it's not convenient to buy things on there because it's like the same price here in Bolivia.
Wow. So it's better to go to the streets. Maybe there is a market too.
Yeah, but exist so many streets, so many avenues where you can buy, and obviously the quality of the products, it's at the same on the places. So I find some interesting places, but the if you have someone, that's a key. If you have
Okay.
someone or you travel these days or maybe these weeks to Argentina,
Hmm?
you must to take pesos or have pesos, you know, because the gift shop, you know the
Hmm.
gift shop at the airport
Yeah.
that sells so many expensive things,
Hmm.
perfumes and so many things. They are selling the things with the official exchange. So
Whoa.
a perfume, for example, that you can buy here in Bolivia or in a normal mall in Argentina that costs maybe $100 in the gift shop. If you have pesos, you can bring it in $40 or $50.
Wow. That's a good thing to know. Thank you.
Yeah.
Thank you so much. I hope to find someone who's going there.
Yeah, and you have to take the pesos. Maybe if you have someone that can exchange your money, before, because you need to the passport to bring on that shop.
Hmm.
So maybe that can give you the pesos that are exchanged the dollar to the blue dollar
Hmm.
in the door, and you can get out to the gift shop. You can
And bye.
buy the things, And also when you are returning, you have don't exchange your pesos into dollars because my
Okay.
father did that mistake and he was crying all the road to
Oh,
Argentina to Viru,
come
he
on.
was
Yeah.
crying, oh my god, I can buy so many, and I say, oh my god, I told you that you had to, because uh, we had separated because I have so many things, and I say you go to breakfast and I go do my things. So in that lapse of time, he changed his pesos to dollars,
So he
and
lost.
yeah, he lost, and he can buy so many things in the gift shop, and I think that that thing that it's very inclusive to sell or to other people that products,
Yeah.
because you can earn so easily so many money, but it's a good thing. But I don't think that the gift shop it maintaining that exchange for a long time, for 2 or 3 months, because they are losing a lot of money.
Yes, I can imagine. For people, but
I hope
uh,
August. I just I just think
to go back
I
there.
want to come back to the airport to exchange the money and buy the things and come back to Bolivia. Yeah, that's all.
Yeah, that's a good thing. Okay,
Yeah.
thank you, Claudia. Um, talking about our topics, but thank you for the tip.
Okay.
What immunizations are advised for visitors to Argentina, for example? Did they ask you any vaccine?
No.
Vaccine.
Well, in Argentina, the whole people are vaccinated with the 4 doses of 2 doses of COVID and 2 boosted. So in total, they have 4 doses for the COVID vaccine. All the people that live there. Uh, they don't ask you if you are vaccinated for COVID, but it's mandatory to have an insurance that covers you if you disease with COVID there. So you can use the insurance for that. That's
You
the
have to pay
You have to pay an international
anyways.
insurance. Yes, for that lasts you maybe 3 months, maybe. And they ask you also, you have to fill I don't know how to say declaración jurada.
Okay.
Mm, and and you have to sign it that you are not in contact with a symptomatic patient in the last days. That's all. But for Bolivia, yeah, they ask you if you have the 3 doses of the vaccine.
Storm declaration.
Ye-
It's called. I will write it down. Okay,
Yeah.
and do you have the 4 doses?
No, I just have the 2 doses of Sinopharm and just 1 boosted with AstraZeneca. And
Okay.
that's all. I was good. I contracted, as I told you, Omicron, but I feel good. It's
Okay.
warm declaration. Oh, okay, thank you.
Yeah, that's the name. Okay. Okay. And what do you think, or which diseases have the highest incidence in our country?
Where the
Okay.
highest incidence on our country, um, I think like the whole Latin American, it's dysentery. That's
Okay.
one. Also, cervical cancer in women. It's very common that so many young women die for that reason. Uh,
That's what
yeah,
about in men? What is the main reason of death in men?
in men,
Yeah.
in like in the whole world.
Yeah, I don't know, maybe in our country.
heart attacks, you know,
Okay,
heart
what
attack.
about accidents, car accidents? Do you think it could be into the main
No,
reasons of the common
laboral
causes?
accidents. In men, I think laboral accidents, because I don't know how to say mineros.
Yes, the miners.
The miners are that people that works or do that kind of work. It's a hard work, so that it's very common in men
Yeah,
for
that's
the
right.
risk to work. Yeah.
Okay, and what are your views on assisted dying?
What I used? How do you
Eh,
know that?
No, what are your views? Claudia. Okay, what do you think about that? What is your opinion?
It was the COVID era, you know. I don't want to talk about it.
Okay.
Well, I, I will be short. Well, my opinion is that you have a moral. If you are a Catholic person or have some religion, you know that it's prohibited because God gives you the life, and the life it will be end when God decide to take it your life. No, so here in Bolivia we don't have specific laws for dying assistance, but I think the most of the doctors in the whole world, um, we have to do it during the pandemic because we need the ventilators, the mechanical ventilation for other patients that have more chances to live.
To survive.
So to survive, exactly. And it's not easy, you know,
Mhm.
but I think one thing that you have to do because you know that that patient will not have a good prognostic. So you have one patient of 80 years that it doesn't have a good prognostic, and you have a patient of maybe I don't know 18 years or maybe 20 years that it's a mom, and you know have more chances. So
Yeah, I understand. Okay,
but
Claudia, thank you
it's
so
not
much.
legal, you know. So
Yeah, here either
no,
it's not illegal.
it's not legal. We just have one term that when you desist and you don't have the reanimation, I think that's all. But the other thing, an assistant at dying, no, it's not legal here.
Okay. Okay, thank you so much, Claudia, and thank you for the tips. I will take into consideration. Okay, and see you tomorrow at 8 o'clock,
See you
please.
tomorrow, teacher.
Take
Bye.
care. Have a great day. Bye bye. Hi, Vale.
Hi.
How are you? Are you feeling better than yesterday?
Yeah, I'm feeling better.
What do you have exactly? Did you
I'm not
eat?
I don't know if it's food poisoning or dehydration since
Okay.
on Sunday I went to the beach and maybe I didn't put enough
You were
sun stuff or
exposed to
drink.
the sun.
So but I'm feeling quite better today. I took some blood tests and I'm waiting for the results.
Okay. Well, that's
Uh-huh.
good to know. Okay,
Yeah.
so you're ready to continue with our class?
Yes.
Okay, let's talk about immunization. What immunizations are advised for visitors in your country?
I think here in El Salvador, maybe, well, at first was the coronavirus vaccine, but now it's not an obligation, so it's not quite necessary. Maybe the J-Lo, no, I'm sorry, Fiebre María, yellow fever.
Yellow fever.
Uh-huh. Yellow fever.
Yellow.
Yellow fever. I was
Okay.
thinking yellow fever
Okay.
and the hepatitis A and B, I think. Hepatitis.
Hepatitis.
Mhm.
Okay. And nowadays, what about the COVID vaccine?
It's not mandatory.
Okay.
Mhm.
Okay, that's interesting. Okay, perfect. And which diseases have the highest incidence in your country?
Right now, because we are on our rainy season, there's a lot of mosquitoes, so dengue fever, influenza, or tuberculosis or tuberculosis. I don't know how to pronounce it.
Tuberculosis, it's the same. It's almost
Tuberculosis, and also COVID-19, right? That is now a very, we have a lot of rate of here, a lot of cases.
okay. And what is the common cause of death on men and women
Um,
in your country?
Maybe hypertension can be um cancer, breast cancer, prostate cancer, and COVID-19.
Okay. Are the commonest,
I
right?
think yes. Mhm.
Okay. And changing topics, what are your views or your opinions about assisted dying?
About what?
Assisted dying.
Mm, I don't know. I'm not pro to do the euthanasia because for my religious purpose, right? My religious, I don't think that we can determine when a person die or not. So just God can take our life.
Right. Okay, I understand. Okay, so you are not agree, but as a doctor, do you think you can apply your convictions, or do you think you have to make it on a side? I don't know.
I don't know. I would prefer not to, but it's a very complicated situation.
I hope
Uh-huh.
you never have to decide that kind of things. Okay.
Mhm.
Okay,
Yeah,
but
and you're against or pro?
I think God can. God is the only one that he can take our life. So I'm pro pro life. So I don't think I can do that. But I don't have to take that decision because I'm a dentist. Also, thank God I don't have to. But
Hi.
yes. So to to not have to take that decision. Can you listen to me?
Yeah, you were a little bit with interference, but now, yeah, I can hear you. Hello? Can you hear me? Ah, yeah.
Okay, Valerie. Now I can hear you. Can you repeat what you were saying, please?
No, I didn't hear you.
I'm
Hola.
so sorry. I don't know what is happening with my connection again, or
Ah,
can you listen
okay.
to me now?
Yes, now yes, I can.
Okay. Can you repeat what you were saying, please?
No, I was telling you that I can't hear you.
Okay. Okay. And the last thing, can you describe a research study that you carried out or you are interested to carry out?
A research.
Yes. What would be a good research for you?
Mm, like what? Like an example?
I don't know. For example, I'm interested in public health. So I would like to make a study or research about education and promotion of health. It would be so good for me, but I don't know. What about you?
Mm, I haven't think about that, pero maybe mm,
Uh, on your last years, you have to make a research
I know a
or
research.
defense.
Yes, I
Okay,
think in our social year, but
okay. And what do you think you will be interested on?
maybe no, I don't know.
What are you into? What are the topics that you are into more than others? What is the area you
Eh,
want to make a specialization?
Maybe cardiologist or um uy, how do you, se me ha ido mi cirugía plástica y plastic surgery.
Plastic surgery.
Ajá.
Okay. I will look for you.
So maybe one of those.
Okay. Okay, but you have to make a research about one of those maybe topics
Maybe some medications that can affect or I don't
like
know.
Botox,
I'm,
like Botox.
maybe no,
Okay.
like or like the difference that that the different manufactured of can affect to different type of treatment or how side effects for the heart. I don't know.
Okay, okay, that's a good thing. Okay, perfect. And what do you think it would be the main problems that you will encounter on research study?
Maybe mm, the people who want to volunteer for the for the trial.
Okay.
Mm-hmm.
Okay, you have to pick up those people very well.
Yes. Mm-hmm.
It would be interesting. Okay, I will take a picture. Just a second, please.
Mm-hmm.
And one last more, and I'll let you rest.
Okay. Yes, and here in El Salvador we have vacation. I mean, this week is vacation. Son
Oh,
fiestas agostinas. So I'm off from the university. I'm just here with this girl.
okay, that's a good thing since you
Yeah,
were
thick.
sick, right? Yeah.
Yes. And
Okay.
today I had a little fever as well. So
No, you were so bad.
yes.
Okay, take care, and I hope tomorrow you feel better. Okay.
Thank you. Bye.
Okay,
Have a good
vale.
night.
Okay, you too. Bye bye. See you
Bye.
tomorrow.
See you.
Hi, Mateo. Good evening.
Good evening, teacher.
Okay, Mateo, let's talk about immunization. What kind of immunizations are advised for visitors to our country?
Yeah. Like we said in class, the most common for us is for visitors is the yellow fever vaccine.
Mhm.
Sometimes they recommend the mostly for first world countries that they get a vaccine for tuberculosis sometimes because they don't have the program we have for the tuberculosis vaccine in the birth after the birth. And I don't really know what. Well, in the current situation, the COVID vaccine is a requirement for the for the arrive to almost every country.
Okay. And I have a question about the yellow fever. Is it the only, it's just one doses, or you have to put another one?
No, it's just one doses. But at first, I think the I don't know if it still the same, but I remember that the one doses lasts like 10 years, and after 10 years, and you have your document certifying that you have been vaccinated, and you have to vaccinate again after 10 years. But I don't know if it's still the same because maybe they improved the vaccine compounds.
Okay. Okay, thank you so much, because I have one since 2004 and I don't know what I'm gonna do. Okay.
Yeah, if I think if you have the certification,
Yes.
you don't need more. But I've lost my certification, so I had to vaccinate again. But I'm not really sure. I'm not really sure.
Okay, I will ask then. Thank you so much. And which diseases have the highest incidence in our country, in your opinion?
I'm sorry, I didn't understood the first.
Sorry, which diseases have the highest incidence in our country?
The highest incidence. Well, currently COVID and respiratory infections. Mostly infectious diseases, mostly because they are continuously um, passing through through people, and tuberculosis is one of the most. It's not really a high incidence, but it's a high prevalence disease, such as a cervix cancer.
Yes.
Cervix cancer is high incidence disease. Diabetes, hypertension in high altitude territories, erythrocytosis. I think pretty much it. And pulmonary diseases too, like
No.
it's not EPOC, it's COPD. Bronchitis, and asthma, mostly in dry places like La Paz, Oruro, Potosí.
Okay. And about that, you already told me one of the common women, but what about men? What is the common cause of death for men?
For men, it's heart diseases like hypertension and sometimes arrhythmias, pulmonary infections too, infectious conditions, because mostly men work in the construction or in the minery, so they get sick inhaling all those fumes and dusts, and causes a chronic illness that then causes their death. And in cancer terms, I think it would be the lung cancer. Lung cancer is the most common cause of death by cancer in around the world. So it must be like that way too. Bolivia.
Okay, what about prostate cancer? Do you think it's a common disease?
Not so common, no. Prostate cancer, no. It is common the benign hyperplasia, prostate hyperplasia. That is relatively common, yeah, but it's not cancer. It's benign, but it's relatively common. And with the surgery, the physicians solve the problem.
Okay. And changing topics, what do you think, or what are your views on assisted dying?
Oof, that's a really tough field. I think I think that in some cases there is really necessary, because sometimes patients just don't want to suffer, don't want the pain, and I think the most human thing to do in those specific cases are is the assist dying. But I don't know a single physician who will do it. So that's the problem, right? So, okay, we can agree that the assistant dying is correct, but who will do it? I mean, at least in Bolivia, I don't think no one could do it. But in the Netherlands, there's a clinic specialized on euthanasia.
Yes, I heard about that. And where do you want to study?
I want to go to United States.
Okay, and there is you can do it. It's legal, I mean.
I'm not really sure, but I think you have some legal mechanisms to accede to that possibility. But I'm not sure. It's not like in these cases you can and you're free to do it. It's more like okay, let's get some paperwork, get it to an ethics committee, and let's decide between everyone. I think it's more like that, but I'm not really sure.
Okay. Okay, thank you, Mateo. And the last question. Can you describe a research study that you've carried out, or would you interested on carry out?
Okay. So while I was studying, I wanted to do a study to like prevent hemorrhagic cystitis or to make a test like a screening test to prevent hemorrhagic cystitis in patients who were receiving cyclophosphamide. These are patients who need to be immunodepressed. And what I was planning was like a cohort study and see the no, it wasn't the cohort. It was a case and control study that we have to analyze the urine of the patients and see if there were some genetic damage among the epithelial cells in the urine, and if that would correlate positively. I'm gonna fill your form. Okay. Then it will be really possible that that this test would work to prevent or to predict this adverse effect. But we didn't have the means to do this. We had to standardize a laboratory procedure and that was money that I couldn't use for the financing. So it was so I couldn't do that, but I will someday.
Yes, I
I
think you
hope.
do.
I hope in the first word. But
Yes. Yes, I think you will. I think
thank you.
you will. You have all the things to do it. And as since you are or you will be a good specialist too, you will find a way to afford the tests. Okay.
Thank you.
Okay, Mateo, thank you so much for your time and see you tomorrow at 8
Okay.
o'clock, please.
Yeah. Thank you, teacher. Have a good
Okay,
night.
have a great night. Bye-bye.
Bye.
Hi, Melanie. Good evening.
Hi, Miss.
How are you?
I'm working, but I uh, make or I asked to have a permission for
Oh,
these 15 minutes. So
okay.
I'm
Thank you so much. So let's start then. Let's talk about immunizations.
oh,
What
okay.
are the immunizations advice for visitors in your country?
Here in Peru, I know that it's important. For example, if you go to the selva, you have
Mhm.
to have the immunization for the yellow fever that is very common in that area. It's important to well, we don't have a vaccine for tuberculosis,
Vaccine?
vaccine for tuberculosis, but it's one of the most common here in Peru too. I think that for all the travels, it's important have the vaccine for the hepatitis
Okay.
A, B, other disease. Mm, well, here it's very common have the acute respiratory infection, but I think that that is the most important vaccine here uh, about hepatitis, about the yellow fever. I'm not sure if we have other is, for example, the rabia. I don't know how to say it in English. That is
Rabi. Rabi.
rabbi. Yeah, that is this
Rabi,
other
yeah.
is important. Yeah, and always in this time for COVID too. No?
Okay. Yes, I agree with you. Okay, perfect. And which disease
Miss, I can hear you. I think that it's the internet.
Okay. Now can you listen? Now can you listen to me? Okay.
Mm,
Which
a little.
diseases have the highest incidence in your country?
Oh, the disease
Okay,
of.
I will write it down.
Okay.
Which diseases have the highest incidence in your country?
Oh, okay. In Peru, we have, for example, all the infection that are.
Okay, now.
Yeah, you can listen to me. Which
Yes,
is it?
now I can.
Yes.
Ah,
Yes. For
continue.
example, here in Peru, we have a lot of respiratory infection that are acute in just days. Is
Mhm.
rep, it's not have a lot of days is recently that kind of infection is included most common in these times that when we have a lot of cold in house. Other disease infection that are common, for example, well, our people have obesity. They many times have a problem in cardiopathies, heart disease, cardiopatías, no? Problem with the heart. And other that it's very common are for example, I don't know how brain vascular problem with the vascular brain, so the ACV. I don't know how to say it in English.
ACV. This is the vascular brain accident.
Yes, the vascular brain accident. They are common here too, and that is the most common because about if we talk in percentage or many the incidents that are the most common
Mhm.
because in other depends too of the area because in other, for example, in the selva or maybe in the urban zones, they have a problem with, for example, infection in the skin or maybe with the
Mhm.
weather that it's very cold. In Puno, for example, that they include diet just for the weather. And depends of the area, but they are the most common in Peru in general.
Okay. Okay, and what about the commonest causes of death in men and women?
Oh, if for gender, for example, in the cases of the men, I think that
Mhm.
one of the most common is they die for example for accident because here in Peru we don't have good good ways. For example, here uh, we have the car accidents, we have road accidents, no, with the car.
Yeah.
Oh, Miss, let me
Yeah.
just 1 minute. I don't know why I
Yes.
have problem with my connection to here in my in my computer. So
Okay,
my
no problem.
Jeep is asking me about my connection. I think that
Mhm.
I don't know what
No
happened.
worries. Take
Oh, I think
time.
that okay. I brought again. Okay, Miss, I'm so sorry. I think that in my computer have problem with my internet, so my Jeep, my jefe, it was asking me about that.
Yeah, your boss?
My boss,
Okay.
Jen.
But if if you want, you can turn off your camera now while we are speaking, maybe to make it fast, to let the internet go fast.
Oh, okay, Miss.
Just this
Yes,
time.
I can hear you.
Yes, sometimes it's the problem. Okay, now can you listen to me?
Yes, yes, Miss. You can listen to me?
Better. Okay.
Okay,
Yes,
Miss.
better. Okay, go ahead.
What was the question? Sorry.
The common cause of death for men and women.
Ah, okay. For the men was the accident. It's very common. Even in my
Mhm.
hospital, it's very common that kind of causes the death. In other areas, we have, for example, um, even we have the problem with the roads. So even our college, when they do the year rural year, it's one of the most common that they have problems in that include they unfortunately dead just for a bad road, and that is one of the problem with the government too. And in the case
Wow.
of the women here in Peru, for example, we have a high mortality about the well, cancer of the female reproductive system.
Mhm.
Most common is about the ovaries and the uterus, and other cases are the pregnancy and the childbirth, because a lot of women in rural zone have their childbirth in their homes, so they don't trust in the with the doctor to have the good assistance in that in all that process. So that's one of the reasons that they did for the pregnancy and childbirth too. Well, I think that was the the most common disease in men and women here.
Okay, yes, that's good. That's good. And changing topics. What are
Mhm.
your views or what do you think, in your opinion, on assisted dying?
Assistant dying. Mm, well, here we have a lot of laws that avoid, no, prohibit the for example the euthanasia
Mhm.
is not available. Recently, I think that we have a request from one patient that has the disease, the degenerative disease for many years. So she asked about the euthanasia, and it's controversial. In personal, I think that depends of the case. If the patient is maybe the disease very very severe, maybe doesn't have the dignity
Severe,
in
severe.
his or her life. Yes. So I think that it's depend. It's a topic very delicate and controversial.
Mhm. Yes, it is. Okay. And the last question, can you describe a research study that you carried out or would be interested on carrying out?
Oh, for I think that I tell you before, one of the my interest area, for example, I like the thing that I can do more maybe in the administration area that in clinical. My proposal, or maybe my usual objective is a, a create laws, or maybe the opportunity, or maybe change in the scheme for the
Politics?
patient. Yeah, the politics, thinking about the patient, because they usually have problem with the documents, maybe with the secure, is not in all the hospital, it's most common that they only have the access in just public hospital, and in the public doesn't have all the exam that is necessary maybe. And when you go in the privacy hospital, uh, all the all that you need is more expensive. So that is maybe my objective, change that politics, have create more permission and access for the patient. Even I like the Korean politics.
Access.
They, for example, yes, for example, in Asia, they have a they first attend all the patient and later think about the ways to the method payments. No, so I think that is, for example, a very good ways to attend the patient. No? First is the life, and later is the method payments. So I can see the questionnaire.
Okay,
Mm,
you can continue telling me what you were saying while you answer. Thank you so much. Now I can ask you to turn on your camera, please, just for the picture.
yes, yes, miss.
Okay, man. Okay, just one more. That's a good idea, what you said about your research. I know someday you will change those politics, or you will add some other ways to make the function better on your
Mhm.
job, or maybe on your country.
I hope
So that's a
have
good
that
topic. Yes, of course, you will. Okay, Mel,
Thank you.
see you tomorrow. Thank you so
Yes.
much for your
Thank
time.
you, miss. No, have a good night. Thank you.
You too. Bye-bye. Take care. Hi, Carla. Good evening. Sorry about about the message.
Don't worry.
I thought that I was texting to Vale to change schedules, but that's why you were like, "Hi, yes, how are you?" And I thought you were writing to me just to say that you won't come to the. That's why I was telling you. You told me that you will come. Yes, but you texted me. That was so funny. Okay.
Don't worry about that.
Okay, I'm so sorry. Let's talk about immunizations. Well, what immunizations advised for visitors on our country?
Well, I think there is much vaccines. Is that correct? Requirements to enter to the country, but it's recommend to some vaccines like yellow fever. But it is more common in tropical in tropical areas, like maybe will be in Santa Cruz, Vietnam, in those places. And will be another recommendation will be hepatitis will be hepatitis A or B for visitors, but
Hepatitis.
sorry, hepatitis, and will be another well, actually the COVID, but COVID-19 almost, I think it's the first and second doses, principally those to vaccines, and maybe if you have the third, I think that, but we don't have much requirements of vaccines.
Okay. Yeah, but those are the main asked for.
Excuse me, miss?
Okay. I think those are the main, the most common that are asked for. I think I will turn off my camera, okay? Just for a minute, because I don't know what happened with my connection, but I think maybe you can listen better now.
I think, yes.
Okay, it's clear. Then, another question. Which diseases have the highest incidence in our country, in your opinion?
Well, actually, well, I know that the sickness of that have the high incidence in the country is ischemia. I don't know how to say in English. Ischemic disease.
Ischemic.
Sorry?
Ischemic disease?
Ischemic heart disease. Is that correct?
Yes, but what is the meaning in Spanish?
Well, will be
What do you want to say?
enfermedad coronaria o ischemia,
Coronary disease.
coronary disease, or most common is ischemia cardiaca.
Okay.
I think that is the most common in the last years, because before there was more common maybe tropical disease or like tuberculosis or those sickness, but actually I think that it's coronary sickness will be the most common that
Coronary heart disease. That's the correct.
coronary heart disease. I think that
Yes.
that's the most common sickness.
Okay.
After that, I think that.
Okay, that's good. And thinking about the common cause of death in men and women, what do you think they are?
I don't know. In Bolivia, maybe will be breast cancer, but it's not more. It's most common in other countries, but well, another maybe will be pneumonias.
Pneumonia.
Pneumonias
Okay.
for men, and for women will be uterus cancer will be. I'm not sure about that. I'm not.
Yes, okay, it could be.
Mhm.
Perfect. And changing our topic, what are the views or your opinions about assisted dying?
Assisted diet is like euthanasia, right? But I think that there is a difference between euthanasia and assisted
Euthanasia.
euthanasia and assisted dying, because, well, as I know, assisted dying is when the doctor prescribe a drug to obviously with the I don't- obviously with the when the patient want it, when the doctor prescribe a drug to kill them. And euthanasia, it comes when the doctor put the
Unplug.
Sorry?
Unplug.
Unplugged.
Yes, unplugged. To disconnect.
Yes, directly. That's it. I think there is a difference in that. In my
I understand.
Sorry?
I understand now.
Okay. And in my opinion, well, I think it depends. There are many opinions about this, and we have to be careful with this topic. And it's illegal in our country. So for religion, religion people, it is they are against of this. And other people say that it's better let the patient die with dignidad. How can I say that?
Dignity.
Dignity, sorry, dignity, because some people are suffering.
Yeah.
Suffering a lot, and also they are the people around them are suffering because the situation is really bad, and it's a lot of gastos.
Okay, it's expensive.
Yes, it's expensive. So some people, when they are old, they want to die because they suffer a lot. So I'm not against the of this assisted dying, but I think we have to be very careful with that topic and see the situation of this person, because and some other people that are agree with this case, they say that each person can how can I say decide when they are going to die, but I think we don't have to decide, but if we are suffering, we can avoid the suffer, I think, but it depends. I am in the middle, I think.
Okay, Carlita, I understand. I truly understand. I hope you never be in that situation. Okay.
Yes. Thank you. I think it will be the worst thing, I think. I don't know. because you
Yes, it would be so hard and
Mhm.
difficult. Okay, one more picture and I'll let you go.
Okay, Miss, thank you.
Thank you so much and see you tomorrow, okay? At 8 o'clock.
Okay, thank you. See you tomorrow.
Okay, take care. Bye, Carly.
Bye.
Okay, teacher.
Hi, Jethro. Good evening. I'm so sorry. And thank you so much for waiting. Hi, Jethro.
Hi, teacher. Good evening. Don't worry. It's okay.
Good evening. Thank you. I'm having some trouble with my internet connection. So maybe if it's not working well, I will turn on my camera, okay?
Okay, teacher. Okay.
Okay. But let's start and let's talk about immunization. What immunizations are advised for visitors to our country?
Okay. I'm not sure about that, but here in Bolivia, I didn't. It's like I didn't not see much that vaccines are required a lot more than other countries like USA or maybe Brazil or Chile.
Mhm.
In Bolivia, there are not are more required in this area, but maybe the more important maybe can be a hepatitis B.
Mhm.
I don't know if the same word in English, influenza. Influenza is the same
Yes.
in English?
Yes, it's the same. It's the
Okay.
same.
Influenza and yellow fever
Mhm.
too, and tetanus maybe. And now for in now maybe COVID too, right? With
Mm.
I think these
Yes.
are the more important, but and what I see here is it's not there is not it's it's not required a lot in Bolivia.
Okay. Do you have the influenza vaccine?
No, no.
Do you recommend it?
Yes, yes, very effective. And it's uh, it's very important. Maybe more in the children's and the old
Your
person.
okay.
And obviously and the nurses and the doctors too.
Okay, perfect. I'm still asking if it's good to have the influenza vaccine. I don't want to, but I will have to to take it. Okay.
Yes, it's
Eh,
good.
okay, it will help. Thank you so much.
Yes, I
Which
forget
diseases?
the vaccine.
Tell me. Yes, me too.
But it's a good one, and I think and the centers of first health is free. The vaccine is free for everyone. That
Yeah, that's right. So we have to do it, Jethro. There
yes,
is no chance we can miss it again.
yeah. Then more in this science for the COVID help us a lot. This vaccine.
Okay, I will take it then. Um, which diseases have the highest incidence in our country?
Disease. Okay, depends of the area. For example, here in Cochabamba, Santa Cruz, the more common disease for it's maybe dengue. I don't know if it's the same in English. Dengue.
Yes, it's the
Yeah,
same.
dengue, chikungunya, and I don't know how to say tuberculosis too. Tuberculosis is the same, or I
It's
think
this tuberculosis.
tu-
Tuberculosis is the same. Yeah.
I think this one and this the last one, tuberculosis, is very uh, is it's very common in all Latin America, and
Latin America. Okay.
Chagas too. Chagas too is more common here in Latin America, in Bolivia too, and maybe another one is is uh, VIH. I don't know how to say. I forgot that word. VIH. Uh,
You mean
VIH.
VI um uh BPH.
Sorry, teacher, I can't hear you.
BPH.
BPH?
Yeah.
I
Now,
think
can you listen?
yes, I can hear you, teacher.
Okay, you were talking about BPH or what other? Oh, VIH.
Exactly, VIH.
Do you think this has the highest incidence? Do you
Yes.
understand? Oh,
Teacher.
continue, please.
I think this is important too. Maybe not often, but it's important too.
Okay. Okay, thank you so much, Jethro. And what are your views on assisted dying?
Assistant dying.
What do you think?
But I think this is depends of the case. For example, if the patient does not want to live or his prognosis is very bad, and maybe, for example, if he is in the more expensive hospital with all the money, but if the patient don't want to live, it don't it depends of the patient, but
Okay.
because he this the he no, it's
You mean you cannot force the
decide
decision of a patient?
exactly he decide in
Okay.
the end of the day, and maybe not the doctor, maybe in the family too, just the patient, right? If in is no matter
Okay, I understand.
patients are in the more expensive hospital with the better doctors and nurses, and it depends of the patients, because I see a lot of patients in my internship with they don't want to be in the hospital, maybe not with prognosis, very bad prognosis, but they say, I don't want to be here, please let me go, I don't want to be here. And I think it's the same in the for example cancer of in these patients, right? For example, in this time of COVID, a lot of patients die, right? And someone of these patients don't want to live. They say, okay, it's enough for me. I take all the drugs and the expensive drugs, and with all equipment, sorry. And I've been here in the hospital for more than maybe 1 month or 2 months. I don't want to be here. Just let me go. And most of cases, the family say the same, tell us the same. Okay, it's enough. Maybe one of them say it's God's decision, right? And they don't want to decide. It's a hard decision for the doctors and for all of us, but at the end of the day, depends of the patient.
Okay, Jethro, I understand perfectly. Thank you so much. I'll send you my questionnaire. Well, I'll give you the last question. Can you describe a research study that you've carried out, or would you interested on carry out?
Hey, teacher, I can't understand. Please, can you repeat, please?
Yes, I can. Can you describe a research study that you've carried out, or would be interested on carry out?
I just hear carry out. Can you repeat another word, please?
Yes. Can you describe any research study that you've carried out, that you have experienced or worked on, or maybe some that you are interested on?
Okay, maybe COVID. It's very interesting. And this disease, maybe COVID. And maybe I like in the area of surgery, maybe another pathologies like
Yeah.
maybe appendicitis or cholecystitis.
Appendicitis. Yeah, appendicitis.
But in another disease, maybe COVID, I'm interested in this disease. It is not clear to for all of us, for all the doctors, and help us a lot know more of this disease.
Okay, Jethro. Thank you so much for your time. It was good. And see you tomorrow at 8 o'clock, please.
Okay, teacher. Thank you so much. Have a good night and go for your vaccine
You
for
too.
influenza.
Okay, I will. You too.
Yes, teacher. Bye. Have a good
Okay.
night.
Bye, Jethro. You too. Bye-bye. Hi, Jorge. Good evening.
Hello, good evening.
Can you listen to me well?
Yes, a little bit with interference, but almost perfect.
Okay. If we have some other trouble, I will turn off my camera, please.
Okay, no problem.
Okay, Jorge. I have a lot of questions for you.
How perfect.
Starting with immunization. Okay.
Okay.
What immunizations are advised for visitors to our country?
Okay, for visitors, right now, I think they're asking compulsory COVID vaccination. I think it's compulsory for visitors. Also, yellow fever is really important for them. Yeah, I think those are the most important. And depending from which countries you're coming, I think almost all around the world now they have the tuberculosis, the BCG one. So I think that would be almost everything.
Okay. Okay, that's really complete. And do you have the influenza vaccine?
Not yet. The influenza one, not yet. Because as I think I got COVID. Do you remember I was sick like 2-3 weeks ago? So I wasn't able to get a vaccination.
Yes, I remember.
And but I should, because I always get flu or cold. That's really frequent in me. I have a bad immune system.
Okay. So do you recommend? But I'm thinking not to take it.
You should. Once when I was in med school, they told us that, for example, influenza one is not as important as other vaccines, because there are a lot of kinds of I don't know, virus mutations regarding influenza. So I remember a professor told us that even if you get influenza vaccination, you might get it as well, because there are a lot of variants of the genes, let's say, regarding the virus. So he told us it's not as important, but who knows, maybe I don't know. Maybe it's a boost, so maybe you can get it.
Yes, I think I can. Okay, I will. Okay, thank you. And well, which diseases have the highest incidence in our country?
Okay, so despite of COVID, of course, because it's a worldwide stuff, I would
Mhm.
say incidence. Good question. Depends on the area too. We can talk about a lot of diseases. We can talk about malaria regarding the maybe the northern part. Also Zika, dengue. Yeah, I think those are really important regarding the northern part. Also, TV is still present, really present in our country because the vaccination did not appear in the list of national requirements, for example, let's say, like many years ago. So there is still a lot of people with TB, and also, yeah, I think TB is one of the most important things in our country still. I remember when I was doing my rural service. I don't know if you had the same requirement to find two patients with TB, and that was a requirement for the score.
Thank God,
I,
no.
okay, perfect. Yeah, because it was a requirement for us for a score. Even I mean, all the we all that were participating in the healthcare center, we had to find at least two people with TB, and we had to take the samples, the sputum test, and if they were positive, we had to do a follow up to that patient, and it was interesting because you see a lot of stuff regarding TB patients.
Yeah, that's interesting. I've never been asked to find those people, but thank God.
Better.
Yeah, better for me. But I have to go with the dogs and give them the rabies vaccine. Uh,
Okay,
it was worst, I think.
that's awful. Yeah, I
Yeah,
think it's worst.
yes, especially with cats. Okay. What is the common cause of death in men and women, in
A
your
common
opinion?
cause. Well, I think something really present nowadays is cancer. I would say that cancer is one of the most important causes of death in many and women. And yeah, I think it's getting worse every day. And yeah, I would say cancer and maybe diabetes too.
Mm, okay. And what about car accidents? Do you think it's a cause of death in men,
Yes,
especially?
yes, it's really frequent too. It's really frequent. You see, I think every day we see in the news car crashes. Almost every day, I could say, almost every day. I don't know, in the highways or maybe from El Alto to La Paz. So yeah, it's really frequent too. Car accidents.
That's
Yeah,
right.
and also murders. Violence. That's something
Yes,
that is happening every
nowadays.
day here too.
Yeah. Okay. And changing topics, what do you think, or what are your views on assisted dying?
Well, that's a controversial issue. Um, I think it depends on the patient. I would say that I agree with someone who is under critical condition. someone who knows that is not going to have a well life expectancy, even though they have good treatment. So I would agree with that people, because I don't think anyone can force you to leave. Anyone can tell you you must enjoy life. If you don't, that's why something really regarding the patient's condition. Well, I think my internet connection is unstable right now.
But I can
This is
listen
my
to you
fault.
very well. I can listen to you. Uh-oh.
I'm so sorry. I think I was
No worries.
yeah, I was without a router, so that's why it was awful. Now I can hear you better and see you better.
Yes, yes, I think the same. Okay, you were telling me.
Yeah, I would say that I would agree regarding the patient's decision, but I think there might be some rules to follow. For example, as I told you, a critical patient condition, um, any kind of illness that would threaten the life expectancy of a patient. For example, cancer, I don't know, renal failure. Um, yeah, basically those that do not have a well life expectancy. And yeah,
For
I
a
think
bad
that,
prognosis?
yeah, a bad prognosis regarding, I mean, despite any kind of treatment. And of course, the patient must be like first being evaluated under a kind of psychology test, so we know that he or she is not committing suicide, just to make sure. I don't know how it works in other countries, but I think they must do it. They take care of everything.
Okay. Thank you. Okay, I will turn off my camera, okay?
Okay, perfect.
Well, and the last question. Can you describe a research study that you carry out or would be interested in carrying out?
Okay, sure. For example, I was working on research study a few years ago, based on, for example, the patients, how they follow the treatment of epilepsy. In this case, where they were like children, because I did it in the Hospital del Niño. So I was wondering the causes of epilepsy first. After that, if patients follow treatment, everything related with the insurance too. For example, in this case, the universal insurance that was implemented like a few years ago from the government, and from which ages it covers the treatment. I mean, the payment for treatment. It only covers children under 5 years old, they tried to enhance that, but it's not working well as they were planning to do it. So yeah, basically medical treatment, because we don't do epilepsy surgery yet here in at the Hospital del Niño. So I think that would be a must. That's why that's what I concluded from my research, and I had to make a list of all the patients, all the ages group, the cause of epilepsy for each case, how long they were following their treatment, if they're following their treatment or not. It was a nice research.
Yes, it seems to be a nice research. It reminds me of a patient a few days ago. He was awaiting for us to attend him. So while he was doing that, he started not to shake, not to have involuntary movements, but to yell in like a fight with nobody that
Okay.
scares us out. But it was I don't know. His nephew tell us that or told us that he was with epilepsy, but I don't know.
Oh, he had epilepsy.
I don't know.
But was it the first time he did it?
No, he told me that he hadn't had a chance to buy his
Oh,
medication, so maybe it was the reason. But as
how?
I told you, I never saw that kind of epilepsy. I thought it was just involuntary movements and not
Yeah,
yelling and fighting with the air.
there are a lot of kinds of
I was
epilepsy.
shocked.
Yeah, yeah. It's shocking because sometimes you don't know what to do. For example, they teach us in the case of maybe the shaking the involuntary movements. It teaches to put the patient laterally laid on the ground or somewhere on some flat surface, and protect the head is the most important thing. But in these cases, you don't know just what to do. It's really hard. But yeah, if they told you that they are not able to buy the medication, yeah, that's an issue. That's an issue that happens.
Yeah, that's a big issue.
Yeah,
I thought that the SUS covers it, but no.
it doesn't. It doesn't. That's what I did the research. I mean, it is only like a little group of people that it covers, and not all kinds of medication. For example, I don't think they cover valproic acid,
Mhm.
and it's one of the most used medications for these cases.
Wow, that's a big problem. Well,
Yes.
I think you should continue with your research. It will
Oh,
help
thank
a
you so
lot of
much.
people. Okay,
Yeah.
thank you so
Hope it goes
much,
well.
Jorge.
Goodbye. Thank you.
And see you tomorrow.
See you
Okay,
tomorrow. Thank you.
bye bye. Okay, Vale, hi.
Good evening, teacher. How are you?
Good evening. I'm so sorry for being late. I was
No, no,
sorry.
it's okay. I think Jorge is one of the most, you can say intelligent, because I know his English is really good. And I think also he knows a lot of medicine. So I like, I was listening and
Learning.
patient how.
Yeah, that's a good thing. That's a good thing, Vale, because you all are amazing. I think as students, you're good, such a good thing. But as a doctors, you will be the best ones. So it's so good that you have that idea, that listening and learning from other people that maybe has more experience or something like that. It's better for you. That's a good start. That's a good thing. You
Thank
will
you.
get so far. Okay. And
Hope God listen to you.
of course. Okay, let's talk about immunization. What immunizations are advised for visitors to our country?
Well, I think for our country, it's important to have like yellow fever. I think is like Jorge said yesterday. I think it's one of the most important all around the world. But talking about only Bolivia, I think it's important to have the vaccinate of tuberculosis because it's an endemic pathology here. And I think we have that program that it's called PI. So I think one of those are really important. For example, I don't know if it's like a requirement to get in to our country, but I think it's really helpful and important. The influenza, la hepatitis, and now like we're talking about the pandemics, it's important the COVID. It's not like 100% sure or it's really so good, but it helps in a little percentage, but it helps. So now I think also COVID is really important.
That's right. So do you think I have to get the influenza vaccine? Because I haven't.
Yeah, when I was talking, in one part of the pandemic, they say that it was like an association or a combination of the COVID and influenza. I don't know if you listen, but in that time I was in my practice year. So my doctor told me I prefer to have COVID than influenza.
So this is the worst.
Yeah. She told me influenza is worse than COVID. So if you can take it, take it. It's free and it's only one vaccinate per year. But it's the nurse that was giving the vaccines told me that this year the government changed because before they used like an Italian vaccine, but now they are using a French vaccine. They put me, and it's strong. I had a lot of like headache. I have fever. I had muscle pain. I had everything at the night, but it's good. It helps you. So if you can go.
Your advice. Okay.
And then after having or receiving the vaccinate, take a paracetamol of 1 gram.
Okay, I will.
It's the best.
Okay, I will. Just one thing. Vaccine.
Okay. Vaccine. Okay.
But you can get vaccinated. So in that case, it's good. But when I will take
you are talking
and you will get vaccinated. Okay.
Vaccinated vaccine. Okay. Yes. Thank you.
And which diseases have the highest incidence in our country, in your opinion?
I think you can say that are three groups. For example, talking about the respiratory system, I think depend the age or the age range. You can say like when you have cough in the child or in the Yeah. When you're a child, I think the most frequently it's
Yeah.
pneumonias and how do you say resfrio?
If you got flu or cold. Cold.
Okay, cold. You got cold or flu are the most frequently. Then talking about
The
like
most frequent.
okay, the most frequent it's the flu or the cold. And talking about like the gastroenterity system, diarrhea.
Gastroenteritis.
Okay, gastroenteritis system, diarrhea. Diarrhea is the most frequently
Okay.
frequent. And then you can talk about like another pathologies that are like high blood pressure, diabetes, those that have like a lot of factors to get that pathology. It's not like, I don't know, you can talk about diarrhea, that it could be caused by bacteria or virus or something that you eat, or the combination of all the things that you eat that cause the diarrhea. But talking about this kind of illness that it's diabetes, high blood pressure, it's like, it's not only one factor that it's like the summatory of a lot of factors that confluate to get the pathology.
Okay. Okay, that's a good thing to know. And what is the common cause of death in men and women?
The most common. Oh, I don't know. Maybe diabetes. Diabetes is one of the most common.
What about uterus cancer on women?
Yeah. It has, I think it's the second cause of death in women.
Okay, what's the
Yeah.
first?
I don't remember. Sorry. But I know that the uterine cancer is
Uterus.
Okay, sorry. Uterus cancer is the second one. Yeah,
Okay.
that's true. Yeah.
And what about men?
About men. Sincerely, I don't know, teacher. Sorry.
A crash cars accident?
Maybe, but I don't think it's the first. Sincerely, but men has more opportunities to have an accident, like a transit accident or like car accident.
Yes.
But I don't think it's the most common. But yeah, you can say yes.
Okay. Okay, thank you. And changing to another topic, what are your views on assisted dying?
I think that, well, I'm agree with assisted dying, because I know, like, imagine that a scenario where it's the person that has a terminal illness. I understand the point that the family loves that person and have the hope that the person get better, or there is a miracle and the person get over the illness, or I don't know, they have faith, they love that person, but you can put on the person that has the illness, because it's painful. I think maybe you get bored also, that in your mind is, okay, I'm bad, and the person see the I don't know how to say angustia.
Worried about.
Yeah, see the pain, the person are worried, you know, always it's the money factor. So I agree, if I have a terminal illness and the probability or get or probability of get better is not too much, I will think about the assistant die.
Okay, and what about in your condition of doctor?
I think that I will imagine, I will try all the ways that the person get better, or maybe if the person has a lot of pain, not that disappear the symptom, but maybe make that the symptom can be soportarlo.
Okay.
I don't know how to say.
They can deal with that.
Yeah, they can live with that.
No, not support it. Feel.
Yeah, that the person can feel, or the person can live with the symptom. Yeah, I will try all the ways, or imagine, asking, search, but I think that there will be a point that, you know, medicine is a science and you can do a lot of things, but you don't have the cure of everything. Like if you want,
Yes.
everybody wants that has I don't know, miracle hands to touch and the person get better and it's and be safe and be healthy, but you can't. So I will try all the things, all the ways. I will ask, search, but if there's a point that you can do more, I will be agreed to get an assistant diet. Yes.
Okay, I understand. Thank you so much for
No,
your
thank you to you,
opinion,
teacher.
for your valuable opinion. Okay, and see you tomorrow.
See you tomorrow. Bye,
Take
teacher.
care. Bye-bye. Thank you. Okay, Ale. Good evening.
Good evening, teacher.
How are you?
All fine, thank you.
Did you listen to me very well or not so much?
No, too much, teacher.
Okay. Can you listen to me better now?
I can understand. I listen, yeah, complete.
Okay. I turned off my camera just to how can I say, just to make work better my connection. Okay.
Okay. Yeah.
Okay. And let's start. Let's talk about immunization. What immunizations are advised for visitors to our country?
Okay. For adults, we don't have a lot of vaccine for a specific places. Maybe that Jorge said, yellow fever is the most, or the classical vaccine for visitors to a country. And maybe the seasonal flu vaccine.
Yeah.
And for the pandemic, maybe the COVID is a rule for some places or some countries.
Okay, even ours, right?
Sorry, did you?
Even our country asked for that vaccine or no? I don't.
Yeah, we have the stational or the seasonal flu vaccine, the yellow fever,
Fever,
and the COVID vaccine.
Okay. Okay. And what about the influenza vaccine? Do you think it's a good vaccine? Do you think I should take it, have it?
Yeah, this is it's a good vaccine. I bought the last year, but this year now. Um, I didn't have problems or some effects, symptoms, or signs after the vaccine. But when I was in the hospital, I see patients with serious complications for the influenza.
Okay. Thank you so much. I would take them.
Yeah.
Excellent. And which diseases have the highest incidence in your country?
Maybe dengue. In our country is one of the most frequently this epidemiologic disease, because we have a lot of cold or warm places.
Yes.
With mosquitoes, and that's the principal vector for transmit this virus. We have just one type of mosquito for transmit the dengue, that is Aedes aegypti. And some curiously is just the female mosquito bite the people or fetus of blood.
Okay. I didn't know that.
Yeah,
That's
I
good.
didn't know too, and
No?
I read that it was so curious.
Yes. Okay, thank you so much, Ale. And the other question is, what is the common cause of death in men and women?
For epidemiology?
Yes, or any other causes that are common.
Okay, maybe both is the principal cause is are accidents.
Okay.
Specifically for women, in our country is well, I'm not really sure, but the cervix cancer, for cervix cancer, that's not really good, because in other countries the first cause of death in women with cancer is I don't know if it's correct, chest cancer or mama cancer.
Breast cancer.
Breast cancer. Okay.
Yes.
But in our country is the cervix cancer. This type is the second cause in all the world, but in our country is the first. We have studies for the virus of this disease, because we have a specific virus that can cause cancer and other just dermatological lesions or ISOs. But in our country, one woman have 3 types or more types of virus that cause cancer. That's that's alarming because we don't have a good education maybe for the cervix screen, like the Papa Nicolau.
Yeah.
Um, uh, and that's the first step for the prevention of this.
Okay.
And in men's, I don't know, I'm not sure.
Maybe can be car accidents or prostate cancer or
Yeah,
hypertension.
prostate cancer. We don't have a lot of education for prevent
Yeah.
this kind of disease, and principal for genital transmission like the papilloma virus.
Yeah.
I see in some hospitals at El Alto and in Village, the women don't like the anti-conceptive
Contraception method.
anti-conception
Contraception.
contraception method. Sorry.
No worries.
Okay, the problem here is her husband, because her husband don't like any kind of contraception method. And I see a woman with 7 children or more.
7 children. Wow.
Yes, or more. And she can with a lot of children.
Yeah, that's right. Poor woman.
Yeah, but that's alarming. She don't want a free treatment, contraception treatment, because her husband don't like that kind of things.
Yeah, I think the machismo is it's still working here on these families, right? That's why women didn't ask for the methods, don't like the methods when they know, and they don't want to know anything about it, most of them.
One thing about epidemiology, I see in El Alto men that have BHI.
Yeah.
Yeah. And Santa Cruz is the first place with is the best place with a lot of causes of sorry,
cases
cases.
What you
Yes,
see.
cases of BHA, and El Alto is the second. And I see men with BH and have his wife, but go to some places, I don't know.
Oh, I understand now. Yes.
Yeah. And is that other thing that is alarming.
Yes.
Because they don't want to use a condom and expand the virus.
Yeah.
And the wife don't know.
Yeah, poor women. That's so by them. But maybe, do you think it's a good thing, or we can try talking about these topics with people are coming to our health centers?
For me, yes, because if we don't talk or if talk, they continue come to that places. But if we talk about it, if we explain the consequences, they maybe not all, but some means understand and have the correctly preventions.
Yeah, that's right. Ale, thank you so much for your time. I will take a picture. Just one
Okay.
moment. Where two pics. Okay, with the answer, and then I let you rest and see you tomorrow.
Okay, teacher. Have a good night.
Thank you so much. See you tomorrow.
See you tomorrow, teacher. Bye.
You too. Take care.
Bye bye.
Bye bye. Hi, Andres. Good night.
Good night, teacher.
How are you? What's up?
I'm fine.
Where have you been?
I'm fine, but I have some problems with my university. It's for that I don't can be in the class.
Okay, but we only have this week and the other one. So please, I ask you to tell me if you want to come to the class or put your license, and maybe talk about two topics on the same class. Maybe it's the only way I can help you, but I cannot put a note or a good score if you're not coming. Okay.
Okay.
Okay. I don't know if you have the chance to watch yesterday's class.
Yes, I can watch.
Okay. What immunizations are advised for visitors to our country?
Well, I know that in Santa Cruz City exists the immunization plans. That it's for babies, kids, and adolescents in different age. Its immunization plan is it's otorgado for the governation.
Okay. They give the vaccines for free.
Yes, it's free.
Okay. And what kinds of vaccines do people need to come to our country?
You can repeat, I don't can listen.
Yes, I'm so sorry about my connection. That's why I turned off my camera, okay? I was saying, what kind of vaccines are asked to tourists to come to our country?
Well, I don't know about that, but I know that it's, for example, one is COVID vaccine, um, tetanus,
Yellow fever?
yes, yellow fever, vaccine for babies, for example, but I don't read about the immunization programs of my country.
Okay. Okay, no worries. Changing topics, which diseases have the highest incidence in our country?
Well, in Santa Cruz, it's a department. It's a tropical department. The diseases that are most relevant in Santa Cruz, it's, for example, dengue, sinusitis, tropical disease, for example, Chagas. Yeah, this disease is most common in this department, in this part of the Bolivia.
Okay, sinusitis, just to, yes. Okay, and what is the common cause of death in men and women?
The common cause of death?
Yes.
I think that hemorrhagic dengue, because in Santa Cruz, it's so common not go to the doctor. The people first go to the grandmother, to grandfather, to
Okay.
Everybody, but not doctor, not hospital, not. It's the last thing for people, and I think that it's for that hemorrhagic dengue is the first cause of death.
Okay. Okay, for both, you mean?
Yes.
Okay. And what are your views on assisted dying? What is your opinion?
Well, it's interesting. I see in the video. For example, in my experience, one friend that I have, his grandfather has a complicated disease, and the doctor says that if the family accept the euthanasia,
yeah,
euthanasia for a method, because the patient are so bad. I think that it's an option because not all families has an economy for
to pay these treatments?
Yes, to pay the treatment. Exists some complicated disease that it's complicated, improve the patients.
Okay. So as a physician, as a future doctor, what is your opinion? You would make it, or you're better not?
In some cases, yes, I accept, but not in all cases.
Okay. Okay, and the last question, Andres. Can you describe a research study you've carried out or you're interested in?
Well, in my university, we have research for all of the career. Yes, I'm interested in research because it's important for medicine.
Okay. What kind of topic would you choose if you have to make a research?
For example, my last research for physiology 1 was cerebral aneurysms.
Cerebral aneurysm.
Yes.
Okay, tell me about that, please.
Well, my teacher of physiology 1 give a word that research about a pathology. I searched about that, about cerebral aneurysms. It's a interesting pathology, a silent disease, because not has any symptom about the disease, and it's most frequently in emergency. It's a neuro emergency.
Okay, so how would you recognize that your patient is suffering from this disease?
Exists a procedure for
posture.
Yes, for recognized patients. For example, if the patient has the head pain, the
headache,
and the most headache
he has.
She has for example, genetic story in the family. If in our family has older person that has a cerebral aneurysm, or if the patient has a cardiac problem.
Okay. Okay, Andres, that was good. But you have to come to classes, okay?
Yes, teacher.
Because I don't know what I'm gonna do to put the score you deserve if you don't come. I really don't know. Okay, try. And please fill my questionnaire. We only have 2 weeks, and I will ask you please to watch the videos of the classes in order to give your test so well. Okay.
Yes, teacher. I was watched the videos.
You were watching.
Try.
Okay, yes. That's good. That's a good thing. It will help you a lot. Okay. Okay, Andres, thank you so much for coming, and see you tomorrow at 8. You will come, right?
Yes, see, all right.
Okay, perfect. Have a great night. See you tomorrow then.
Thank you, teacher. Goodbye.
Goodbye. Hi, Weimar. Good night.
Good evening. Good
How
night,
are you?
teacher.
How are you?
Teacher, voy a aumentar el volumen. No escucha.
Of course, if we have some trouble with my connection, I will turn off my camera, okay?
Okay, teacher.
Okay, but do you listen to me well?
Yes, teacher.
Okay, perfect. Okay, so Weimar, let's talk about immunization. What immunization advice for visitors we have here in Bolivia?
The most recommended are mainly the yellow fever vaccine to access certain endemic areas of the country. For example, in Cochabamba, tropics and Santa Cruz, Beni, Pando.
Tropical areas.
Yes, teacher. Also, other vaccines in the Indian region, typhoid fever, hepatitis,
Hepatitis.
A and B, y tetanus.
Okay.
They are endemic in the Indian region.
Okay. Okay, that's good. And I'm sorry, continue.
Eso, teacher.
Okay, that was all. Okay, which diseases have the highest incidence in our country?
Dengue incidence is coming in the tropics, Santa Cruz, Beni, Pando.
Okay. What about the other ones?
Also, chikungunya, Zika.
Okay, what about uterus cancer or cervix cancer?
The incidence of cancer is more common in women, for example, cervical cancer.
Okay.
Teacher.
What is the, sorry.
And lung cancer people in who how smoke what smoke.
Sorry, can you repeat, please?
Lung cancer in people what smoke or
lung cancer.
Lung cancer.
Lung cancer.
Lung cancer. Sí.
Okay. Cancer. It's the same in Spanish.
Lo que quería decir, teacher, bueno, cáncer de pulmón en personas que fuman. Entonces, la
Okay.
parte de qué, no, qué, no, quería utilizar what o who. Ahí me...
Who?
Who.
Yes, you have to think in English.
¿Qué? What?
Who
Preguntas, teacher.
smokes?
Yeah, who smoke?
Yes. Lung cancer in people who smokes.
Yes, teacher.
Or yeah, that's correct. Okay. And what is the common cause of death? I already told you that, right? No. What is the common cause of death in men and women?
In the woman is cervical cancer. In the prostatic cancer.
Okay, in men.
For yes,
Prostate.
for prostate cancer.
Oh, prostate con T.
Prostate.
Yeah. Okay. And changing to another topic. What are your views on assisted dying?
Me dijo muerte asistida.
Yeah.
Le escuché eso. Eso
yes.
escuché.
Yes, that's right. What are your opinion?
It is literally a matter of life and death, and one of the most difficult to solve, both individually and socially. I do not agree. Young patient only God can take your life. However, I believe that in some cases it is really necessary. For example, terminal cancer. Terminal cancer is because it is really because they suffer a lot.
Okay. Okay, that's a good thing. No. While I'm asking you the last question, can you please fill my questionnaire? I don't know if you can see it.
Yes, teacher.
Please. Do you have any research on your mind that you are doing right now? Or would you like to have any kind of research?
Teacher, no le escuché bien, teacher.
I'm sorry.
Y el cuestionario no puedo enviar, teacher.
No, you can't.
And just, perdón, teacher, es que me faltaba. Yes, teacher. Yeah.
Okay, thank you so much, Weimar. One more. Okay, Weimar, that was good today. That was good. You have to improve. You have to be better than yesterday, okay?
Okay, teacher.
And remember, we just have left this week that comes and the other one. So please, no, yes. Okay, so please study, read once again, and watch the records. Okay?
Okay, teacher.
Okay. See you tomorrow then. Have a great night. Bye, Weimer.
Goodbye, teacher. Thank you.
Hi, Jocelyn. Good evening. Can you listen to me?
Hello, teacher. Good evening, teacher.
Good evening. Can you listen to me well?
Entrecortado, teacher.
Okay, let's have some patience, please. If it's getting worse, I'm gonna turn off my camera, okay?
Okay, teacher.
Okay. Jocelyn, what immunizations are advised for visitors to our country?
Okay, teacher. The basics that I can recommend for travelers in Bolivia. For example, hepatitis B, influenza reinforcement, to prevent colds, especially in the highlands, yellow fever in the valleys, and valleys, or
Okay, on the tropical area. Okay.
And COVID-19.
Okay.
To prevent the different disease that can be can tragic during your trip.
Contract or it can be during your trip.
Teacher?
Sorry. It can be contagious during your trip.
Yes.
Okay. Okay, that's good. Can you listen to me better?
Teacher?
Can you listen to me better? ¿Me escuchas mejor?
Yes.
Okay. Okay. Which diseases have the highest coincidence? I'm sorry, incidence in your country?
Okay, teacher. The prevalence diseases in Bolivia.
The incidence, Jocelyn.
The incidents in Bolivia are COVID-19, in the tropic, dengue, Chagas, chikungunya, and yellow fever.
Yeah.
In the highlands, high blood pressure.
Okay.
And common cold.
Okay. Continue. I'm sorry. Okay, that's good. And what is the common cause of death in men and women?
Okay. In men, lung cancer prevails due to cigarette smoking,
Okay.
and cancer prostate, and cancer testicle. In the women, it is cervical cancer, because they do not have a pap smear.
Okay.
Cancer breast, and cancer breast.
Breast cancer.
Breast cancer. Breast
Yes.
cancer.
Breast cancer. Okay. Changing to another topic. Jocelyn, what are your views or your opinions on assisted dying?
Teacher?
What are your opinions on assisted dying?
Yeah. And sobre la muerte asistida, ¿no, teacher?
Yes. What is your opinion?
Also called euthanasia, which is the direct provocation of death out of pity or compassion to avoid suffering, avoid suffering at the request of the patient or the family. For example, patient in a coma or with terminal illness.
Okay, Jocelyn.
Teacher, una consulta. ¿Cuándo puedo utilizar illness y diseases?
Son sinónimos. Son sinónimos, Jocelyn. Como sickness. También es un sinónimo. Sickness, diseases, condition, you can say too. Puedes decir condición también. Los síndromes son los que varían, pero para decir ciertas enfermedades, tú tienes que saber cuáles específicamente puedes usar cualquiera de esos. También, ¿qué más? Sí, esos tres son los más comunes. ¿Ok?
Okay, thank you, teacher.
No worries. Okay. And can you describe a study, a research study that you carried out?
Teacher?
Can you listen to me, Rosalie?
Sí, describe nomás, le entendí, teacher.
Oh, describe a research study that you carried out.
Okay.
Or that you interested on.
Okay, teacher. I would like to do research on the risk of hypoglycemia in patients using insulin or oral and anti-diabetes. To avoid the complication, the hypoglycemia.
Ok, ok, Jocelyn. Esta vez estuvo mucho mejor que antes. Estás pronunciando muchísimo mejor y me parece excelente. Am, te voy a pedir que por favor llenes mi encuesta para que te tome una fotito. Me parece muy bien, has mejorado bastante, pero tienes que seguir practicando, porque una cosa es leer y otra cosa es responder, ¿verdad?
Ajá.
I'm sorry. Oh. Okay, Jocelyn, thank you so much. And see you tomorrow, okay? At 8 o'clock.
See you tomorrow. Goodbye, teacher.
Take care. Goodbye. Bye-bye.
Goodbye.
Hi, Carlita. Good night.
Good night. How are you?
I'm fine, thank you. A little bit tired, but fine.
Yes.
How are you? You too?
I was just looking that I had sunburn.
Whoa. The sun was
Today was
so hard. It was for today?
Yeah, but my skin is so sensitive. I don't know. And I was in a stadium. So I think it was that.
Yes.
Yeah.
Wow. But maybe you have to put some moisture or something like that.
Yeah, I'm gonna take this off.
I
was
Yes,
just
please.
so busy at work, and I didn't notice this. So I was just how do you say rascarse?
It was itchy.
Yeah, I was I'm sorry, rascando
It
acá.
was,
And
but it's not painful.
yeah, and I was just saying it's burning, but now that I just got connected, I saw this.
Wow. Yeah, it's so red.
Yeah.
I feel bad for you now. Maybe you can put some milk
Yeah.
and
Just
on tomato. It helps too
yeah.
with that kind
Yeah.
of.
Yes. Tomato, it's a good one. I used that once when I went to Galapagos. I got so
Yeah.
burned, and I used tomato. It's really good.
Yeah, but you have to be careful though. Otherwise, you will suffer the consequences of this. Oh,
Yeah.
it's really rare.
Yeah. And my skin is so,
I
I don't
hope
know why.
for tomorrow you can recover.
Yeah, and also I used to got burning my um head. So well,
Your forehead? Oh my
yeah,
God.
yeah. But I that's something I
Okay,
cannot.
it's part of life. Maybe you
Yeah.
have to. Maybe you have to buy a big hat like a mariachi.
Yeah, it's a good one, but it was something of the
Yeah.
how do you say alcalde? Alcalde. The I forgot the name. The el alcalde de acá, de donde yo vivo, tuvo un
Okay.
lanzamiento, entonces tuvimos que estar ahí y era el sol terrible.
Okay. You have to use your uniform.
No, I was with this clothes.
Oh, okay. Okay, you
Yeah.
have to be careful time,
Yeah.
Carlista. Okay, then let's talk about immunization. I want to know if you have to give some advice to the visitors for immunization vaccines in your country.
Well, here in Ecuador, we have BCG vaccine. I don't know if in Bolivia you have to receive that.
Yes, we have.
Yeah, that vaccine is for newborns. At the same time with hepatitis B. And when you have 2, 4, and 6 months, you have to receive the regular vaccines. So they contain diphtheria, tetanus, measles, poliomyelitis.
Yeah.
I forgot. I forgot. La OPV es
BCG.
la tosferina. I don't know how to say that in English. And
Yes, phosphorine. I think it's
tosferine.
phosphorine. Yeah. That is that we call in Spanish pentavalente.
Yeah. So well, the regular scheme of vaccination have some variety. For example, in 2012, every child has to receive in those vaccines in 2, 4, and 6 months, and they have a reverse of measles at 5 years. So when my son had 5 years, so 5 years ago, the health system not
Not
required.
response. Okay.
No, not required this measles reverse because the prevalence, sorry, the incidence was so loud. So those children that have scheduled, sorry. So those children don't have the reverse.
Okay.
But
That's
now, after the COVID outbreak, we have some this new vaccination, the COVID, from all the people. So here in Ecuador, in this month, August, the health system is going to require this carnet.
ID.
Yeah, this ID from
ID vaccination.
Yeah, this ID vaccination for 3 doses of COVID.
Okay. So if I want to go to your country, I have to have the 3 doses.
Yes.
For COVID.
Yes.
Okay.
Yes. Since August. And if you are an Ecuadorian and you want to go to the supermarket or a mall or any public space, you have to take your ID of the 3 doses.
Okay.
So it's a kind of control. But there's a problem with the people with anti-vaccines people. I don't know. Yeah.
Yes, we have those thinkers here too. And yes, it's a problem. That's why we are living with or dealing with that that new virus.
Yeah.
What is the name? Something with monkey.
Monkeypox.
Yes, monkeypox. And actually, we have one case here in Bolivia, in Santa Cruz. Confirmed.
We have 3. Yeah, and then I just look at these vesicles, and I don't know, I'm scared of that.
No, I really don't know how it appears. How is the appearance? I don't know. Can you tell me or describe it for me, please?
Yeah, it's similar to chickenpox. I don't know if you can see in the image. I have here a scar and here's some other.
Yeah.
I got monkeypox when I had 2 years, and you have fever and some vesicles in your all over your body, and if you how do you say it, scar? Ay, me olvido.
Let me check, because it's when you have something that it's uncomfortable and you feel like you have to. I don't remember either.
These vesicles are very itchy, and if you
scratching,
if you scratch, if you scratch these vesicles, those vesicles got ulcerate, and you have those scars. And in monkeypox, in the field literature we have about this disease, it's very similar. It's like the flu, and you have headache. Also, you can have fever, and then it appears some vesicles all over your body, and it could be very dangerous because we don't have a vaccine, so people could die. I think it's something stressful because you can't transmit the people by this flush.
Yes.
So I think we have to keep using this mask, and I don't know, refers the cross ventilation in indoors, the interperson distancing, and washing our hands. So I think we have some time left to using mask. And with this new variant of COVID, here in Ecuador, 2 weeks ago, we had the lowest prevalence because COVID now it's prevalent. The prevalence of COVID was 75 cases per week. And the last week, with this new variant, we have 16,000 per week.
Wow.
It was
So
crazy.
fast.
That's why my son had COVID. And today I saw a patient with COVID. The Saturday I had 8 patients with COVID. So it's out of control.
Wow. But the symptoms are not so hard than
Yeah.
the first wave, right?
Okay. Yeah, that's true. It's something like the flu, but that it's contraproducent because people think it's just the flu and think
They
it's
do
not
not use.
gonna get worse, so they don't use masks inside houses. It's something that we're not human, don't understand. So I think
Yes. We are
uh,
irresponsible.
yes, as a society we don't understand anything. It's so complicated. The patient I saw today told me, I think I had a flu and I have this COVID antigen test in my car. So I think I told him, well, I make you the test and you know if you have COVID or not. So I made the test, this antigen, and it was positive. And he said, no, I'm not going to say to anyone of my family because tomorrow we are going to go on vacations. And I was thinking like,
oh no. How terrible that.
yeah. And I
Oh.
was just like, okay, do whatever you want.
Do whatever you want, just go out of it. Yes. But I think you won't have any trouble maybe being contagious with the monkeypox because you already have it.
Yeah. Well, with monkeypox, I don't know. I'm not so sure about it because with chickenpox, it's a different virus. This herpes virus, and monkeypox, it's a different virus. So I think we all are in risk to.
I thought it was the same.
No, the name is similar, but it is a different virus.
What are we gonna do?
Yeah, I think people got normalized with these outbreaks with those viruses, but they don't realize until they have it. So, and when affect the skin, I don't know, I'm freak. I had some I'm a little scared of this monkeypox, but I'm scared more of the irresponsible people. So you don't know what the people is around you. I work now in this in Ecuador. It is called Consejo de Salud. In Ecuador, we have 3. One is in the city I lived, and is considered the most the best Consejo de Salud. But I have this chef, and she is coughing all the day. And I just said, use the mask. And she said, no, I don't have COVID. I think you're scared of a little flu. And I think it's so irresponsible. Yeah.
Yeah. I don't know what are we gonna do with these people. And maybe sometimes they're disrespectful because even though you don't think it won't happen anything, maybe because of empathy, you have to use your mask and take care, right? But people
For
don't do
respect to other people. To respect to
Yeah.
other people. You can do whatever you want with your life, but you cannot unrespect the health of other people. So it's kind of complicated. And as a doctor, I hear any crazy things, and it's kind of I'm in this problem with the ethical. As a doctor, you cannot say the diagnosis of your patient, but you know that the
Yeah.
patient can transmitir, I don't know, contagiar,
Transmit or
and
yes,
transmit. It's
transmit
the same
or
thing.
being being contagious.
It's the same thing with AIDS. If you have a patient with AIDS,
Yeah.
you cannot say anything, even if that patient don't say to their wife, their, I don't know. It's really complicated as a doctor.
We have to regulate a little more that norm.
Yeah, it's really complicated. Years ago, I had a patient who tried to kill himself with a knife. So
my God.
there was blood all around the hospital. It was a mess, and that patient had AIDS, and that was the consequence that he decided to kill himself. And it was just curious because a my colleague, it was his partner, his boyfriend. I don't know, they were gay.
Oh,
so
no.
I cannot say anything that he had AIDS, and I think my partner too. And I just have to be quiet and respect that, because it's the confidentiality of the patient.
Yes. How hard
So
is that?
yeah, I
Okay,
think
so we
that's
have
the
to be
reason
careful.
because I think
Yes.
that's the reason, because that's the reason why we don't control those disease outbreaks.
Yes. And maybe as a doctors or professionals in health, we have to insist and be persistent, telling people that they
Yes.
should take care of themselves and giving them the indications, even though they are not taking into consideration what we're saying, right?
Yeah, it's really it's
Even
some
though
cultural. It's some cultural too, and I think
it's frustrating.
yeah, as a society, we used to be xenophobic. We used to, I don't know how to say that, even fascist people with strangers, with people with some diseases, with this discapacidad. I don't know how.
Yes. Capacity, I don't know. Let me check.
Yeah, and we as a society have all those social stereotypes. So I think we're far from a change. If COVID does not change our mind as a society, we're far.
Yes. Disability is the word that we were looking for.
So people with disability and I don't know, with some catastrophic diseases, etc. So I don't know,
Yes,
someday,
it would
somehow,
be chaos.
after the nuclear war,
I hope someday
maybe we change.
we can be more responsible. Yeah. Okay, Carlita, thank you so much. It was a pleasure talking to you, and
Thank you
see
too.
you tomorrow.
See you tomorrow. Have a good night. Thank you.
Take care. Have a great night. Bye-bye.
Bye.